This COVID-19 podcast from Ridgecrest Regional Hospital was recorded on Thursday, March 19th, 2020. COVID-19 has left us all with questions, concerns, and honestly, anxiety. Joining me today to help answer our questions and hopefully help us feel a sense of calm are Dr. Stephanie Crapo and Megan Stone, both of whom are available to help you at Ridgecrest Regional Hospital. This is Health Matters, a podcast from Ridgecrest Regional Hospital. I'm Scott Webb. So doctors, thanks so much for being on today. Let's start here. Let's start with the current status of COVID-19 in the U.S. and in California. Dr. Crapo, why don't you take that one?
So this data changes every minute, but it was updated about an hour ago. So as of an hour ago, these are the latest numbers. In the United States, we're seeing about 11,000 cases of COVID-19. California has 904. And Kern County has 2 cases. What's important to note is that we're seeing the number of positive cases increase across the state, and that's the expected pattern of the virus. This is not something that's unique to California.
Okay, that's good to know. So while, of course, it can be alarming to hear these stats and that the numbers are going up, it's, hate to say it this way, but it's kind of to be expected. Okay, so Dr. Stone, what are the symptoms of COVID-19? Because I think there's a lot of confusion out there. Is it kind of like a cold? Is it more like the flu? What are the symptoms of COVID-19?
The main classic symptoms that we really want people to be aware of are the fever, cough, and shortness of breath. But of course, as with any viral illness, there are so many other symptoms that can go along with it. But the ones we're really looking for and we really want people to know about, once again, fever, temperature greater than 100.4, new or worsening cough, and new or worsening shortness of breath.
Okay, Dr. Crapo, how is testing done for COVID-19? I wish it was kind of like the quick strep test that I used to get for my kids where we'd know within 5 minutes. It's not quite like that, right?
That's exactly right. The mechanics of it is that it's done with a simple nasal and throat swab. And the tricky part about it is that it requires that the person meet specific criteria set by the CDC and the state prior to the provider even ordering the test. And these tests can have a 4 to 5 day delay right now because across the state we are seeing all of the labs being inundated with these new tests being ordered.
And in terms of the testing, I know across the country I've heard that hospitals are starting to do basically drive-up testing. Are they doing that in California?
Yes, that has been started in California, and actually we are starting that process in Ridgecrest. So there is a process for it, and if somebody feels that they are having symptoms of COVID-19, they can text screening to 833 RRH for you, which is 833-774-4968. And after that text, a triage nurse will call the patient and will review the symptoms and help decide if you should be seen by a provider and if you meet those specific criteria so that you can make an appointment to be tested at the drive-up clinic.
And we really want to make sure, right, that people don't just go to the hospital or emergency departments requesting a test if they don't have any symptoms, right? That there is a screening process here and people need to follow that whenever possible.
That's exactly right. It's really important that if people are either asymptomatic or if they're having mild symptoms, that they're able to treat at home and don't come to be seen because it takes up a lot of resources for those patients who are very sick and need the emergency medical care.
Right. We want to save the care for those who really need it. That all of this has put such a stress on all of our systems and materials, masks, gloves, hand sanitizer, all of that. So if you're asymptomatic or you feel like it's kind of a low-grade treatable home type of thing, that's where you need to stay, right?
Exactly. And we recommend that if you are having those low symptoms, which I'll just reiterate again, low-grade fever, cough, mild shortness of breath, please do stay at home and self-isolate. Wash your hands a lot. Drink plenty of fluids to get rest. Tylenol for your fever. But again, if you do have severe symptoms, please call or text your doctor, and you may need emergency care at the emergency department, which we can do if you're having those severe symptoms.
Yeah, that's great. And definitely don't dismiss severe symptoms. We're learning a whole sort of new nomenclature, a language with COVID-19, self-isolate, social distance, things like that. So, Dr. Stone, what are some ways that we can protect ourselves and our families during this outbreak?
Well, first of all, we need to remember the things that are very simple, but we tend to forget, which is what we're hearing over and over. Wash your hands, please, many times, much more than you're used to. Covering your coughs, covering your sneezes, wearing a face mask if you're going out or if you're going to the doctor's office, and avoid sharing personal items in the home that you may have possibly shared before. Keep everything as separate as possible. And also, please, while you're staying home, we really want you to be mindful of your mental health and your mindset and how you're feeling. When you are isolated or you're bored, this can be really provoking for anxiety and depression. And so we really want people to remember that some of the most powerful things they can do is just to promote an overall sense of well-being for themselves, their friends, their family. Stay in touch with family and friends over the phone, even if that's something that maybe you might not normally do. Practice deep breathing, even if that is something that you wouldn't normally do. If you have access to the internet, try new classes for exercise, meditation, yoga. A lot of them are free online. And also just really focus on keeping an overall sense of being calm and a sense of wellness. And that will do wonders for your immune system. And lastly, this concept of social isolation. Of course, none of us are very used to this. We don't usually do this. But we really need to try our best as a community to do our part to slow down the spread of disease. This social isolation is a proven method to slow disease, and it's really important that we do what we can, even if we believe ourselves to be healthy, that we stay home as much as possible, only go out for specific needs, doctor's office, to get food if needed. Very, very critical point right now that we all do what we can. However, if you really think that you need medical care, please remember that we're definitely here for you at Ridgecrest Regional Hospital. And don't forget the text number, 833-774-4968. If you text that number, once again, our triage nurse will call you back, discuss your symptoms, and decide, can you stay home? Do you maybe need to come to our drive-up clinic to be tested for COVID? Or should you be speaking with your provider or possibly even go to the emergency room, just as Dr. Crapo said earlier? So there's a lot of things you can be doing for home. Don't downplay how powerful they are and how important they are.
That text service is really cool. Yeah, that is such amazing thing that you're doing, and I hope everybody takes advantage of that. Dr. Crapo, last word to you today. Anything else you'd like people to know about COVID-19 and what they can do during this time?
I think Dr. Stone said it all. There's a lot that everybody can do from home to protect themselves, their families, as well as the community. But also that if we are needed, we are here for you at Ridgecrest, and we are here to take care of your medical needs.
Definitely. Well, thank you so much for being on. I feel like we're going to talk again. I wish it was under better circumstances, but lovely to have you on. Great advice, great information, and everybody stay well. Thank you. And thanks for checking out this episode of Health Matters. Head to rrh.org/podcasts for more information. And if you found this podcast helpful, please share it on your social channels and be sure to check out our entire podcast library for topics of interest to you. Thanks for listening, and we'll talk again next time.